Welcome to the Holistic Kid Show. My name is Zane.
And my name's Abdullah.
We're the Holistic Kids, here to educate and empower us kids from the inside out. Do your parents say that us kids are a pain? Pain can affect our parents and us kids, making life miserable for the whole family. Chronic pain affects so many families.
About 36% of adults have pain, and we think pain might not be a problem in kids, but studies have shown that 12% to 25% of youth have pain-related conditions, like migraines, abdominal pain, and even chronic pain. Kids that have pain can actually lead to other symptoms like sleep problems, feeling tired all the time, depression, anxiety, and so many other conditions. So not good for anybody, the child or the parent.
Yes, so not good.
Well, today we have an amazing doctor that can help us understand pain. Dr. DeCaria is a double board certified in anesthesia and pain management by the American Board of Anesthesiology. She is also a mother of two and best-selling author of the new book, Break the Chronic Pain Cycle, a 90-day program to diagnose and eliminate your pain.
Thank you.
Dr. DeCaria did her anesthesia residency at the University of Chicago and pain fellowship at Northwestern University. Since completing fellowship, Dr. DeCaria was on faculty of the University of Chicago for half a decade. She now owns her own integrative pain clinic, Revitalize Medical Center outside Chicago. She specializes in a holistic approach to chronic pain.
Hey, we live in Chicago too.
Yay! I know. I hope to meet you guys.
Us too.
How are you? Thank you for having me.
Welcome, Dr. DeCaria. Thank you for joining us today.
Thank you.
Can you tell us a little bit about your background and why you chose to treat people with chronic pain?
Sure, I'd be happy to. So you already did an awesome job introducing me, so thank you for all of that. I chose to go into pain management sometime around medical school. My father actually was a chronic pain doctor as well. And so I did a lot with him, and I really felt like it was a field of medicine where you truly touched people's lives, and it embodied everything I wanted to do, because there's no better feeling than if you actually get someone feeling better and out of pain and able to regain their life back. So it was an easy choice for me. And since then I went through all the training you talked about, and now I have my own clinic.
Now let's start with the basics. What is the difference between regular pain and chronic pain? What makes it chronic?
Sure. So, we separate it into acute and chronic pain, and acute is pain that is short-lived. So typically the cutoff is about 3 months. And that's when we start to say, okay, somebody is actually suffering from what we call chronic, which means long-term pain.
I know that if someone has pain, they get anti-inflammatory. Inflammation is the fire in our body created by our immune system as it tries to get rid of the infections or heal us from trauma. And you talked about an acute pain and chronic pain. There's also two types of inflammation. Good inflammation or acute inflammation, and that is the quick response to injury and bad bacteria to fix what is wrong. But the bad inflammation, chronic inflammation, is your body has constant fire because of constant stimuluses that don't stop. Is pain due to chronic inflammation too?
Yes. So, when we have an acute injury, just like you said, it's a good thing when your body feels pain and it sends all these cells there and everything's trying to get better. That's a good response. But chronic pain happens when a lot of times these injuries have actually healed themselves and people continue to have pain. And so one thing you talked about with the inflammation is true. It may be that there's a continuous source of inflammation or a continuous strain on an area that's causing that pain to continue to be present. But then there's also a whole lot of other factors that go into chronic pain. And that's what makes it so complicated, because actually with chronic pain, your brain gets involved and there's a lot of other things that get activated, and chemicals and hormones that kind of perpetuate that pain cycle. And so that's why it becomes very hard to treat, because a lot of times the inflammation even can appear like it's gone, but the pain is still there.
So what are the other causes of pain?
So there's many different causes of pain, but I like to think about pain in different categories. And so the one that we think about the most is something called physical pain. And just like you talked about, inflammation is a big tie to that. So physical pain, if you think about knee pain or back pain, different parts of your body hurting, that's usually when we think about physical pain, that we can tie the pain to an area in our body and it makes sense. But then there's a lot of different types of pains that sometimes don't even have a physical injury. There's something called fibromyalgia. I don't know if you guys have ever heard of that, but it's a condition where you suffer from widespread pain. Your whole body hurts, but there's no injury. And there's a lot of things in science that we actually don't really fully understand yet. And there's many pain conditions we don't really fully understand. One of them is fibromyalgia, that there's still a lot of science that needs to be done. But because there's conditions where physical issues aren't going on, there's other things like I talked about, the chemicals, the hormones, sometimes diet plays a factor, like you may be sensitive to a certain diet and that's causing issues like headaches, for example, or belly pain. There's a lot of different things that play into the different types of pain, but inflammation is one component. But again, like I said, it is very complicated.
What led you to develop your own holistic approach to pain?
Sure. So, it was funny because I had actually never experienced chronic pain myself when I finished all my medical training and was a full-fledged pain doctor. And then about 1 or 2 months after I finished all my board exams, I started to suffer from chronic pain myself. And when it came to myself and how I've always been with me and my family, it was a very holistic approach that I wanted to take. I didn't really want injections and surgery and medications and things like that. I wanted to get better and I didn't want to live in pain. I was, 30 something years old. So I dived into additional holistic education because there was so much that my training hadn't taught me that I felt like was really important in treating pain. So I looked into functional medicine and integrative medicine and all this stuff your mom is doing. I also tried to get all that education too. And then through that, I developed my own system as I was continuing to treat patients and myself. And, as I started to see, I got better and then I was able to help other people. It was really rewarding to just be able to use all these different types of medicine to figure out what was the best plan for someone given the type of pain they had.
That's such an inspirational story. A happy mom equals happy kids and family.
Yeah, you are right.
Right, Zen?
Yeah, it makes everyone happy.
Yes.
You specialize in busy moms with pain issues unique to women. What type of issues do you see and what is your approach?
Sure. So, I was that prototype. So that's why I think either I attract those type of patients or it's just, patients that I feel like I really know a lot about. But the thing that I see is that the interesting thing about chronic pain is that, I don't know if you guys know this, but 70% of people that suffer from pain are women. And another issue is that in our healthcare system, women are also facing what we call bias. And I don't know if you guys have heard that term before, but there's gender bias in medicine, meaning that women in pain actually are being treated less effectively than men that have pain or boys that have pain. So there's two factors playing into why women are suffering. Not only do they have more pain and higher pain syndrome conditions, but they also are not being treated effectively a lot. And so I'm passionate about that and about busy moms and professional women, because I think that a lot of times we feel like pain is normal or, we're so busy taking care of everybody else that we kind of forget ourselves and we let go of a lot of lifestyle things and maybe let go of some nutrition and exercise we need to be doing, live under a lot of stress. And, what started out as little aches and pains ends up being so much pain that we can't take care of our loved ones. And it's something that I really want to help those people.
That's horrible. But
Horrible.
you're doing such a great job. You said
Thank
your
you.
pain issues started around your pregnancy. Do you see this a lot? And why can what can women do to prevent these aches and pains from becoming lifelong problems?
Sure. And yes, I do see this a lot. It's funny. Sometimes I'll see someone in their 60s or 50s or 70s, and they'll think about when their pain started, and they're like, oh, it's about 25 years ago, I've really had back pain. And then I'll ask them how old their kids are. And a lot of times it'll be like, oh, he's 25. And they'll tie their pain starting around that period of our life. And that's what happened to me too. Our bodies go through a lot of changes when we're making these babies and carrying you wonderful children. And unfortunately, there's also some injuries that can happen during that time that is usually neglected because we are so overwhelmed with the joy of having kids that you just forget about it and you think, oh, it's normal to have aches and pains during pregnancy and the postpartum or post-pregnancy period. But there's a lot of people that don't have pain. So if you are experiencing pain, it's important to try to address it early. Talk to your doctor during the pregnancy, do things that you can do even before you get pregnant, but definitely when you're pregnant, to try to stay in good shape. Your physical therapist is your best friend. And it's also important to remember that the pregnant body is different from the non-pregnant body. Ligaments are looser, your body is changing, your pelvis is changing to accommodate the baby, and you need to make sure that you are doing things the right way. So if you do exercises, make sure you're not getting injured. And if you do start to notice pain, talk to your doctor about different things you can do to prevent it from turning into something that's more long-term.
What are steps moms can take to prevent pain?
Sure. So I would say, kind of a little bit of what I just talked about. So the first thing is that if you start to have pain, and even if you don't think it's that severe, I would talk to someone about it. And again, just a visit with a physical therapist can usually really help you diagnose imbalances, because what I see is the biggest issue in moms and women is that we develop certain muscle imbalances, which means that either from the right to left of your body or the front to back, there's an imbalance in the muscle strength, and one side ends up being stronger than the other, and then that leads to issues on the weaker side. I usually see that with kind of, shoulder tightness, neck issues, and back issues, and as well as like legs and hips. So it's really important that if you're noticing pain, you address those things, because usually it's something that you just need to fix with some strengthening and some exercises, and then you'll prevent a lot of things down the road, whether it's arthritis developing or tendonitis developing or all sorts of pain issues, just by addressing it early. And then the other thing that moms need to do is prioritize themselves, because I know it's very hard to do that, but we do need to prioritize our own mental health, address stress, address our own nutrition, try to eat as healthy as we can, because like we talked about earlier, our diet plays a huge factor in low levels of inflammation constantly being there. And that can trigger a lot of pain issues without even us realizing it.
We know that the house of the immune system is the gut, is in the gut. And when things are balanced, everything is working well. But when kids eat junk foods, it can lead to leaky gut and inflammation. What role does nutrition play in the development of pain?
Sure. So I know that one well because it actually happened with me. So it ended up being that, I got to a pretty good place with my pain with a lot of different things, some stress reduction and exercises and all these different things I changed. The one thing that was remaining that I didn't realize was low levels of inflammation from a sensitivity to a food, which I didn't figure out until I went on an elimination diet. So there's a lot of pain conditions related to that inflammation that starts in our gut, because exactly like what you guys said. And it could be migraine headaches, it could be, belly pain, it could be fibromyalgia. It presents in so many different ways for different people. But really, I do believe that everything does start in the gut. And when you think about how pain is conventionally approached, a lot of doctors look at it like a physical thing, and they're looking at your hip or they're looking at your shoulder, and no one's really looking at that gut as being a source of where this inflammation and this fire is coming from. And it lands in different places in different people. It may be that your hip in one person and it may be foot pain in somebody else. So it varies.
What foods should we stay away from?
And what foods help with pain?
Sure. So, and this is true for a lot of things. So if you think about heart disease and diabetes and all these things, we think of inflammatory conditions. Pain is actually a complex chronic disease, just like those. And so a lot of the diets that we talk about for those types of conditions, like the big anti-inflammatory type of diet, lots of fruit and vegetables, green leafy vegetables, trying to eat healthy proteins, trying to minimize red meat. Things that are a lot of pain triggers are things like dairy, sugar, gluten is for a lot of people. A lot of the things that irritate people for a lot of different conditions will trigger their pain as well. But if you're able to eat a whole food, non-processed diet, that's going to be the best thing for you, because getting all those vitamins naturally and eating those type of foods and avoiding the sugar and the things that are going to increase that inflammation, that's what's going to help you heal from the inside. And it's better than any supplement you're going to take, because ultimately you can't really get rid of, if you're not repaired from the ground, it's going to be hard to just kind of throw supplements and fix everything else.
Do you ever treat children with pain issues? What advice do you have for moms or children with pain?
Sure. Yes, I do treat children. I don't treat very young ones, but I do treat children still to this day. And the first thing I will say is that kids, you guys are very resilient. You get injured, but you get better really quickly. And most of the time kids will heal. But if you find that your child is complaining of a lot of pain and something isn't really adding up and it's not going away, or even if it just persists even more than a few days, always talk to your doctor, because the main thing is you want to make sure there's nothing serious going on. We don't want our children to be harmed. But, taking that aside, a lot of what I'm seeing are pain conditions in kids that are kind of split into one of two categories. I see a lot in teenagers with anxiety associated or stress associated pain conditions, a lot of headaches and a lot of abdominal pain. And maybe you guys have had something like that, where you feel really nervous or scared and your belly hurts. Some people will have something like that, some kids, and it'll be very, very severe. And then the other thing I'm seeing a lot of in kids in the last year or so is a lot of upper back and shoulder pain, which I really hadn't seen for a long time or in very high numbers. And now it seems like more and more kids are getting it. And I think it's that, we're stuck inside, school's closed. A lot of kids aren't getting that recess time. We have a lot of devices and we're just more sedentary and less active than ever before. So kids are just like, kids need to get out there and exercise and eat healthy too. But really the activity, kids need to keep moving. And it's the same thing, like I said, with the moms. If your back starts to hurt, or you're starting to hurt and things are getting to the point where it's hurting you every day or regularly, the kids should say something to their moms too, and that's something that you need to know, because it's you don't want it to turn into a chronic issue for your kids as well.
Most kids today are insulin resistant. Insulin is a hormone that helps to regulate our blood sugar. In order for glucose to enter the cell, you need insulin to act like the key to open up the door. But because the kids are eating too much processed foods with too much sugar and chemicals and living with chronic stress, this leads to your body ignoring the insulin, leading to insulin resistance or pre-diabetes and inflammation. Does some pain kids deal with, like headaches, can be due to these hormonal issues?
Yes. Yeah. Headaches for sure. More than anything else is a lot of times tied to hormonal changes and hormonal issues. In fact, we see migraine headaches, which is something that is a very, very severe type of headache that tends to happen more in girls, more in women. And they think that one's related to hormones as well, different kinds of hormones than insulin, but hormones. So there's definitely a tie between all of these things. And usually people that have developed like type 2 diabetes, they live in a pro-inflammation state. So just like their body's inflamed, and having issues with the diabetes, that can also lead to a lot of chronic pain issues as well. So everything is kind of tied together. And when your body is not doing well, just like you said, you're eating those kind of foods, and more kids are having obesity, and there's a lot of pain issues tied to obesity. And, we never used to see kids with things like knee pain, because knee pain was something that developed, over time. It's arthritis, and then it develops with age and with time and with walking on your knees for a long period of time. But we're seeing it now in children, and it's mostly in kids that are obese, because your joints aren't really set up to hold up that much weight. And so all these things that play a part into why we're just seeing more and more and more pain in younger people, and also in moms and just our whole country, unfortunately.
What sort of lifestyle therapies do you recommend for moms or kids suffering from pain?
Sure. So, and I personally, so I'll tell you what I like to do with my kids. I have 2 girls. We do cosmic yoga. I don't know if you've ever heard of it, but we do yoga every day. And, I involve my kids with things like meditation, and we teach them about nutrition, just like what's going on in your house, all that education, and making it really like a family, like your lifestyle is your kids' lifestyle. And it's a big, big part is making it everybody's choice and everybody getting involved. And, right now we're growing like a little microgreen garden downstairs with my daughters. Making healthy living fun for the kids and a part of your life is important. And that's, thinking about nutrition. My book actually goes over like an exercise program that you can do to prevent kind of the most common pain issues. And so, it's a lot of different strengthening exercises. It's important to do a variety of exercises, but definitely, strengthening things like yoga, Tai Chi, these are all really helpful. And then, the final thing is stress reduction. And that really does take effort sometimes. And it takes, putting time aside to really work on what's causing your stress and trying to find ways that you can manage it. And sometimes you need to get help in all of these things. Maybe you need to get a therapist. And part of it is just realizing what areas you need to work on and really prioritizing your lifestyle and your health.
We would love to hear about your new book.
Okay.
Our mom.
I'm sorry? I think you just cut out for a second there.
We'd love to hear about your new book.
Okay.
With our mom.
Okay. So my book is a 90-day program. It's called Break the Chronic Pain Cycle. And it's a program using, again, all the different types of medicine that I studied. And the first part is you take a quiz and you figure out what kind of pain you have based on what I think are like the broadest categories of pain. And then you go through a program based on what kind of pain you have to address it, eliminate it, and then really focus on a lifestyle of anti-pain. So there's kind of, a plan for moving forward in terms of what diet you need to consider and what type of exercises you should be doing. And, everything from how you should be sitting in your desk to, what type of footwear you should wear. I mean, it's all over and a really like comprehensive guide, I think. And so I'm really excited about it.
That is so exciting.
Thank you.
Wow, pain can be so miserable. What can kids and parents start today to help them lower inflammation and help them with their pain?
Sure. So I would say the first thing is to start making some goals. And, if nutrition, let's say, like all the different diet things we talked about today is something that you realize, oops, I'm not doing those things, start small. That's going to be your biggest bang for your buck to reduce that inflammation. It really is. And so, sometimes my patients aren't ready to go full on anti-inflammatory diet. But what I tell them is just, okay, let's cut out processed and packaged foods, get it out of the house. Instead of reaching for the bag of potato chips, grab an apple and eat it with some almond butter, just small changes. And, maybe it's going to be cutting out soda and having sparkling water, or just, water with a lemon in it. Just different little things you can do. And then as you do those little things, you'll start to notice you're feeling better. And then hopefully you'll get, some more encouragement and to kind of continue with that. But I would say diet is really the first thing that needs to be corrected and really addressed. And then from there, try to exercise regularly, like at least 2 or 3 times a week, at least, ideally more. I know there's a lot of busy moms. So, you really want to try like every other day to be doing some sort of activity for 30 minutes. And then also take time for yourself. As moms, we don't do that very much, but that 5 or 10 minutes to either be practicing some gratitude, to do a quick meditation on your app or something, to just, even take a walk outside, whatever it needs to be, to just get yourself out of that fight or flight response, that high cortisol, high stress life that we live in, and learn to really just, bring yourself down and reduce stress overall. It's really going to make a big difference.
So you have young kids. What do you do? What do you and your kids do daily to help them lower inflammation and pain?
So, well, we try to do our best, because we are busy, but usually on most days we try to do 15 or 20 minutes of a little yoga video on YouTube. And again, super easy, but my kids love it. And it's something that we all do together. And then there's certain days that we just try to do a meditation together. And that's harder with my 2-year-old, but my 10-year-old, she's pretty good about this stuff. And she's really into healthy living just from what she hears about everything. The 2-year-old, we struggle a little bit with her, but I think she'll get there eventually. She's not there yet, but we try to do our best, and even just like sitting down at the dinner table, we put our devices away and we try to talk to each other, and we try to talk about things we're grateful for, talk about, things that bothered us during the day. I mean, I really think just like that connection and that community and that communication helps your children, but it also helps you. And, just gives you that break from our phones and from constantly being connected to work. And those are the things we do. It's not big things, but, it's little things like that I think ultimately help.
You were so inspirational. Where can we learn more about you and your work and your new book?
Thank you.
Can you please tell us where you how to?
Oh, I'm sorry, I couldn't hear you guys again. I don't know if it's my connection. I apologize. What was the question?
Can you please tell us about where we can learn about you, your work, and your new book?
Oh, sure. So just like you guys, I'm in Illinois. I'm just, my office is right outside of Chicago, but my website is www.DrDeCaria, that's DeCaria.com. The book, Break the Chronic Pain Cycle, is available on Amazon as well as Barnes & Noble. So, you can get it there. You can also go on the website and sign up for my email list and get a copy of the first chapter for free, and also be notified of some new things I'm coming up with, which is one of them is an online course to actually go along and be more detailed and provide a more specific plan for certain things I talk about in the book. And those are the places. And then they can follow me on social media too.
To recap Dr. DeCaria's key points.
The immune system is the army of our body, protecting us from things that don't belong. Inflammation is the fire in our body created by our immune system as it tries to get rid of infections or heals from trauma. Always talk to a professional to help your chronic pain. So by putting our bodies back into balance, we can learn we can lower this inflammation and lower chronic pain. We can lower inflammation by physical therapy can help to address chronic pain. That will prevent a lot of other issues. Moms need to prioritize themselves, and they need to take care of themselves. Avoid foods that increase inflammation, like limit and eliminate sugar, processed foods, artificial foods, unprocessed foods, and that will help you from the inside. And it is better than any supplement you can take. Get out and keep moving to help your body inside and out. Exercise 2 to 3 times a week. Managing stress, as stress can lead to most chronic conditions, as it makes your gut bacteria sick, increases cortisol that increases insulin resistance, and makes you sicker and overweight that can lead to inflammation and chronic pain.
Focus on gratitude. Gratitude keeps you focused on the positive things in your life, increases optimism, and allows your body to lower inflammation and work better. Also, see a that can help you and your root cause of why
you have pain.
you have pain.
To clarify, you will also see a practitioner that can help to find your root cause of why you have pain.
Wow, Dr. Korea, that was so amazing. Thank you so much for joining us today.
Thank you guys. It was wonderful to meet you.
Thank you everyone for tuning in. Until next time, I'm Zain Ansari.
And I'm Abdullah.
Follow my family and I on social media, Holistic Mom MD, and look out for my mom's book, The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease, and the amazing children's book we wrote together called Adam's Healing Adventures. So check it out on Amazon. Yay! Remember, our bodies and our health is a huge blessing, and we need to take care of our bodies the best we know how. Please spread the world with all this health, and kids need to learn from other kids. Please download our podcast on iTunes and leave a review so other kids and families can benefit. We need to work together to create a healthier future for all of us. Join us next week for another episode of the Holistic Kids Show, where kids are empowering kids. Thank you, everyone.
Thank you.